Greetings or good day, everyone. So we are assigned to discuss to you the Precede and Proceed model. So this presentation consists of Ms. Abamonga, Ms. Acuna, Ms. Adan, and Mr. Vincent Estilla. So hopping into this slide, you can see here the Precede and Proceed model is a comprehensive structure na nag-a-assess ng health needs for designing, implementing, and evaluating health promotion. Health promotion is like educating the clients to be aware of the good health and other health programs to meet those needs. So this model has worked uh, for many health promotion topics and can effectively support one-time intervention or yung mga long-running programs. So yung Precede is nagbibigay siya ng structure sa planning ng isang targeted and focused na public health program, while yung Proceed naman is nagbibigay ng structure for implementing and evaluating ng isang public health program. So, para mabilis natin maalala, ang Precede is for planning and yung Proceed is for implementing and evaluating. So yung purpose and relevance ng Precede and Proceed model is una, nagbibigay siya ng structural framework for developing the behavior change intervention. Pangalawa is yung model na to is ginagamit for monitoring and evaluating the intervention program. So it is necessary for us to monitor and evaluate our intervention program para ma-assess natin kung effective ba yung ginagawa natin. Participatory model din tong Precede and Proceed model since nangangailangan to ng participation and involvement ng community. And kapag merong ganon is nag-i-increase to ng community ownership ng program. So yung contents, methods, media ng isang particular program is selected accordingly based sa mga needs ng program. Ang relevance ng model na to is nagbibigay nga siya ng structure para makapag-develop ng coherent, very detailed, and thorough plan. Thus, ina-address nito yung mga problems effectively. So, nagko-concentrate to sa isang mga issue at the time na ini-eliminate yung chances na itong mga cases ay ma-unhandled.
Next is Precede. So Precede stands for predisposing, reinforcing, enabling constructs in educational diagnosis and evaluation. So it is based on the premise that just as medical diagnosis precedes a treatment plan, an educational diagnosis of the problem is very essential before developing and implementing the intervention plan. So under Precede, we have 4 phases, and each phases will be discussed later on. Next is Proceed. Proceed stands for policy, regulatory, organizational, constructs in educational and environmental development. So it is the treatment portion of the model and comprises the implementation and evaluation of the intervention. We have 4 phases din po under the Proceed. And each din po is para-tackle sa next slides. So these are the phases of Proceed model. So phase 1 is the social diagnosis. So it determines what the community wants and needs to improve its quality of life. So dito, nakafocus tayo sa kung ano yung wants and needs ng community natin. So, dito natin ma-identify yung ating desired outcome. Next, phase 2 is the epidemiological diagnosis. It determines the health problems or other issues that affects the community's quality of life. So dito sa phase 2 is hinahanap natin yung issues and factors that may cause or influence the outcome we have identified in phase 1. And we need to select those that are most important and that can be influenced by an intervention. So, yung phase 1 and phase 2 identifies the goal of the intervention. Next is phase 3, educational and organizational diagnosis. It determines what to do in order to change the behavioral and environmental factors. So dito natin ma-identify yung mga predisposing, enabling, and reinforcing factors that can affect the behaviors, attitudes, and environmental factors given priority in the phase number 2. Next is phase 4, administrative and policy diagnosis. Designing programs or interventions that and the support for them through administrative and policy diagnosis. So dito is i-identify natin yung internal administrative issues and internal and external policy issues na pwedeng makaapekto sa successful conduct ng ating intervention. So yung phase 3 and phase 4 naman is for planning and design of the intervention. Next is phase 5, implementation, conducting the intervention. So dito na natin i-carry out yung ating intervention. Next, phase 6, process evaluation. Determine whether the intervention is actually taking the actions intended. Are we really doing the things that are planned to do? So, nasusunod ba yung process ng ating intervention? Next is the phase 7, impact evaluation. Determine whether the intervention is having the intended effects on behavior and or the environment. So, dito naman sa phase 7 is the intervention having the desired impact on the target population? So, nata-target ba dito yung people in the community na kung saan tayo nakafocus? Okay. Next naman is the phase 8, the final or the end phase po ng ating model. So, it is the outcome evaluation. So, it determines whether the intervention ultimately brings about the improvement in quality of life identified in the community as its desired outcomes. So, is the intervention really working ba? Para ma-bring niya yung outcome na na-identify natin doon sa ating phase 1.
Now this is the graphic that shows how the Precede models function to find desired results by assigning priority measures for possible obstacles that can hinder ultimate goals. Makikita natin sa top portion ang mga phases ng Precede. It includes the social assessment, epidemiologic, behavioral and environmental assessment, educational and ecological assessment, administrative policy assessment. So here, it includes identifying predisposing, enabling and reinforcing elements that affect behaviors, attitudes, and environmental factors, and also administrative policy considerations that determine what can be done. Sa babang part naman ay makikita natin ang mga phases na included sa Precede, in which it includes implementing to-do design and conducting the intervention, evaluating the profit center, evaluating the impact of their target population, and also evaluating the outcome and how it aligns with what was planned in phase 1. Few strengths of this model is that it has a comprehensive and rigorous structure as defined by the diagrams through a logic model with inputs and activities outcomes. It includes SMART goals, it sets up distinct planning phases and interventions, and the model has a flow wherein the data can be collected at multiple stages and can be analyzed in the same or different phase to understand the community or health issue at hand. And lastly, it encourages collaborative partnerships with working with the community and all different viewpoints.
Next is criticism disadvantages of this model. By positive criticism, I mean any constructive criticism that focuses on the strong points of a piece, and negative criticism is any constructive criticism that focuses on the weak points of a piece or the parts that need to be improved. And it is precisely and coherently planned that sometimes it isn't appropriate for the current setting or circumstances. And it gives precise instructions to follow that may at times not be viable with the current issue. And next po, thank you for listening. And here's the references na pinagkuhanan po namin ng report namin. And feel free to ask po. Thank you.